Hi, I'm Dr. Lakshmi Ahir, cornea consultant working in Patel Eye Care and Laser Center. Today I will be talking about eye donation and cornea transplantation. Eye is a beautiful creation of nature through which we see this beautiful world. Now, when we think about the eye donation, what are the questions that comes in our mind? The first question is, who can donate the eyes? The person of any age group, sex, religion, socio-economic status can donate their eyes. Those suffering from diabetes, hypertension, asthma, cardiac disease, and those suffering from a non-communicable disease can donate their eyes. Can living person donate their eyes? No. Person can donate their eyes only after the death, and eye should be donated within the 6 hours of death. The another question many people ask me that who cannot donate their eyes? The person who are suffering from or who have died from HIV, hepatitis B, hepatitis C, rabies, septicemia, infection, leukemia, lymphoma, any cancer, or those who have died due to drowning, they cannot donate their eyes. Now, if someone wants to donate the eyes of their near or dear one, what are the precautions or what are the steps they have to do? The first, they have to inform the nearby eye bank. Then those person who are died, they have to close the eyes of the donor. Then the moist cloth has to put on the eyes so that the eyes they are not drying. The fan which is there inside the room has to switch off. AC if there in the room, it has to switch on. Then the head of the donor tissue has to be elevated with a pillow to decrease the bleeding while taking a eye donation. Once somebody has informed to the eye bank, the trained person from the eye bank comes for the eye donation. In this case, they remove the eyes from the person and then they also collect the blood sample. What they do for this blood sample? Okay, for this blood sample, they run certain tests like HIV, hepatitis B, hepatitis C and RPR for the syphilis, so that to decrease this communicable disease transmitting from the donor to the recipient area. Once this eyes has been taken by the eye bank, this eye is thoroughly evaluated and processed by the eye bank. Now certain people ask, okay, what are the other documents they require for the eye donation? For eye donation, there no documents are required except the death certificate or the donor. Is the consent is needed? Yes. Consent of the people of the donor, those are blood relatives or a close relative, they have to give the consent for the eye donation. Without the consent of the near relative, eye donation cannot be taken. Now, can we store these eyes? Yes, we can store these eyes. Some of the people think that once eye donation has taken, it has to be used within the 3-4 hours or some in short period of a time. No, because of a new invention, we can store these eyes. We can keep in the fridge at 2 to 8 degrees for the 48 hours. Even now the MK medias, other medias are available in which we can store the eyes till 14 days. Even in organ culture, we can keep these eyes till 30 days. And in case of the cryopreservation, we can keep the eyes till 1 year. Now, there are the certain myth about the eye donation. People think that if we donate the eyes, our eyeball will be, their face will be disfigured. No, after eye donation, there will be no disfigurement of the face. Some thinks that there will be a lot of bleeding after the eye donation. No, after eye donation, there is no bleeding. You will feel like there is eyes has not taken only. It will be as it is that was there previously. Some of them think that because of the eye donation, there will be delay in the funeral process. No. Eye donation takes only 15 to 20 minutes. That's why there will be no delay in the funeral procedure. The another one is there. Somebody thinks that there should be a pledge. People should pledge their eyes before the donation. No. Even if somebody has not pledged their eyes, they can donate the eyes at any time. The another very funny, but some believe that if they donate their eyes, they will be born blind in the next birth and they won't be able to see the God. These all things are myth. It's nothing true. That's why we should donate the eyes. These all are myth. We should not believe in that. Now, many people ask me that the whole eyeball is transplanted. No, the whole eyeball is not transplanted. Only the few parts of the eyes are transplanted. First is the cornea. The cornea is anterior most part of the eye, which is like a glass through which we can see this beautiful world. It allows the light to enter inside our eyes. The another part which can be transplanted is the sclera. Sclera is the white part that we see around the black part in our eyes. And another one is certain stem cells which can be transplanted by eye donation. Many people ask me, what is an eye bank? Okay, eye bank is like a blood bank in which we store the eyes, we process the eyes, evaluate the eyes, and it is distributed to the needy person. We can keep the eyes into eye bank for a longer duration of a time. Now, there are the 2 to 3 million of people in our India, those are blind due to corneal disease, and which leads to the blindness in the other society. And these are the cause of the corneal blindness can be cured with a eye donation. Cornea is what? Cornea is the anterior part of the eye through which the light pass and which we can see this beautiful world. It is like a glass. It is crystal clear. Like we are sitting in the car and our windshield is how they are. We can see the beautiful world. We can see the roads and everything. The same is like cornea. If our windshield of the car is broken or it has become a cloudy, we can't see anything. The same thing occurs in the eye. When the cornea is get infected or it is damaged due to trauma or any disease, we won't be able to see this beautiful world. It leads to a decrease in the vision a lot. Now, somebody asked me that what are the different type of cornea transplant surgeries available? There are the different type of cornea transplant surgeries. The first one is penetrating keratoplasty. The penetrating keratoplasty is in which the full thickness of the cornea is transplanted into the recipient part. When the whole cornea is damaged due to certain disease like a trauma, infection or some degeneration or a dystrophy. In this, the full thickness of the cornea is transplanted into the recipient area. It can be used for the vision purpose like a optical purpose to increase the vision of the recipient area. The penetrating keratoplasty can be used for the cosmetic purpose also, in which the few people are having a white opaque cornea but it looks very cosmetically bad. So we can use a penetrating we can do the penetrating keratoplasty surgery in those patients also to increase their cosmetic appearance also. Another one is therapeutic keratoplasty. In case of the therapeutic keratoplasty, we do some of the patients, those are having an infection in the cornea which is not treated by the routine drops or a treatment, and they are not responding to the routine treatment, or there is a thinning or it is about to perforate a cornea. In those patients, we do the therapeutic keratoplasty. In the therapeutic keratoplasty, the healthy donor tissue is placed inside the eye and those tissues were infected, they are removed. And another one is the tectonic purpose, to maintain the anatomy of the eye. In the certain cases in which there is a severe corneal thinning, the cornea has come out. In those patients, we can do the penetrating keratoplasty to maintain the anatomy of the eye. Nowadays, the people do ask me also, how you fix this donor tissue into the recipient area? We fix this donor tissue into the recipient area with the help of the sutures. We take a 360 sutures around the recipient area, and the donor tissue, the donor cornea is fixed inside the eyes. Nowadays, the different type of another surgeries are available also. This is called as a lamellar keratoplasty. In case of the lamellar keratoplasty, there is two types. One is anterior and one is a posterior. It is divided into the anterior and the posterior depending on the anatomy of the cornea. Cornea has an anterior part which is responsible for the thickness and for the shape of the cornea, and the posterior part. The posterior part is responsible for the clarity of the cornea. When certain pathologies are there in the anterior part, like some scars, some degeneration or a dystrophy, or in some cases like a keratoconus. The keratoconus is a disease in which the corneal shape changes, or in the case of the patients, those after the refractive surgeries, the shape has changed. In all these cases, in which the anterior part of the cornea is damaged, we do the anterior lamellar keratoplasty. That is also called as a deep anterior lamellar keratoplasty. In these cases, we remove the anterior diseased part of the recipient, and from donor tissue, the posterior part which is healthy in the recipient area, that is also removed, and the anterior part of the donor and posterior part of the recipient, they are sutured with one together. Now the another is posterior keratoplasty. In case of the posterior keratoplasty, it is also called as a DSEK or Descemet stripping endothelial keratoplasty. In those cases, the posterior part of the stroma, which is posterior part of the cornea, which is responsible for the clarity of the cornea, if that is damaged due to some intraocular surgeries or some dystrophies or due to some hereditary condition, in these parts we remove the posterior part of the recipient and the posterior part of the donor tissue is put inside the eye, and this posterior part of the donor tissue is stick in the case of the recipient area with the help of the air or a gas. In case of the posterior penetrating keratoplasty, it is sutureless surgery. In this case, we don't suture anything. Now, the people do ask many questions like what are the complications of this all keratoplasties? The main and a major complication is rejection. Rejection do occur because the donor tissue is not our tissue. Any injury or any infection can lead to the rejection. The another one is infection, and the most common, and the another one is the suture related problems. Sometimes broken suture infection due to some number, all these things are the complication of the keratoplasty. Now some people do ask me, is the keratoplasty successful? Yes, due to the new inventions and new technologies, the keratoplasties are successful. It leads to the increase in the vision of the many people, and it also helps into saving the multiple people. That's why my take home message will be, don't burn, don't bury, donate your eyes so that many people can see this beautiful world. Thank you.